Well, the Best for the Bush report is important because it actually demonstrates, just like the National Rural Health Alliance Nous report, that there is a massive underspend in rural, remote and regional Australia. That 30% of the population is not a third world country. We actually need to make sure that they access the services. And in addition to that, the data shows that the majority of people that live in rural Australia are worse off in terms of their health care, in terms of their health outcomes, and females in remote Australia are living 14 years shorter than somebody that lives in urban Australia. These reports demonstrate that there is a $6.55 billion underspend, which means about $850 per person per year, less expenditure. In addition to that, it demonstrates that we're still not closing the gap for Aboriginal people, and we are definitely not closing the gap for people that live in rural areas because they have the tyranny of distance. And the reports are evidence that we need to measure against every year, because if we don't measure it, we will not actually make a difference. The Best for the Bush report definitely aligns with the National Rural Health Alliance priorities because it deals with all the issues that many people are not willing to deal with. One of them is that we don't have a compact across state and federal governments currently to work together and actually deal with rural health issues rather than them being separate. Reasonable access in rural Australia means that everybody has the same ability to access health services. Rural, remote and regional Australia brings in 2/3 of Australia's export income. It puts 90% of Australia's food on the table, and that 30% of the population brings in 50% of the income from tourism. And they deserve the same services, the same healthcare, and the same health and well-being as urban Australia does. Well, the gaps for rural Australians is that they don't have access to the same services. They have a shortage of doctors, shortage of nurses, allied health professionals, anybody that works in healthcare along that patient continuum, from the day they're born all the way to the day that they pass away. And what it actually means is that we actually need to change the way we deliver healthcare. It has to be a population health need that is transferred into a service delivery model that might be different in one community compared to another community, because no rural community is the same, and it definitely isn't the same as an urban centre.